Hello and welcome. I'm Paul Tunnah, the founder of Pharma Forum and Chief Content Officer at Healthware Group. Great to be speaking today with Ardy Arianpour from SEQSTER. Ardy, thank you so much for joining me.
It's so great to be here. Thanks so much, Paul, for having myself and SEQSTER on your fabulous show.
Thank you very much. And, love the work that you're doing. I know we've chatted about this offline quite a bit, but before we dive into kind of SEQSTER and what you are doing and how you're transforming healthcare, give me a bit of background, because you've had quite a strong background in genomics and real world evidence. Talk me through your journey to where you are now.
Yeah, it all started, 20 years ago. I've been in genomics, clinical diagnostics, healthcare, and then now digital health for 20 years. And it all started with a passion of bringing together science and technology. Unfortunately, my family was affected by, cancer early on. So I got involved in oncology very early. And then from there, built out some of the world's largest clinical diagnostic labs, understood the power of the genome, and then understood the limiting factors of just looking at your DNA data. And that's how SEQSTER was born, SEQ for DNA sequencing and STER for all the other data, your EMR data, your claims data, your pharmacy data, your lab data, social determinants of health data. And here we are today. And you fast forward to 2023, patient centricity has been the number one topic now, I think, in the last 2 years or so, ever since the pandemic.
Yep.
And we couldn't be more, thrilled to be powering some of the world's largest, companies with our technology, specifically for pharmaceutical companies, patient registries, and clinical trials.
Yeah, fantastic. And as you say, we're just starting to see the power of how that can transform healthcare. So, as I say, you've done a variety of things. It's not your first company you've started. It sounds like the evolution and the founding of SEQSTER was a gradual process, but was there a particular light bulb moment where you were like, this is exactly what this company needs to do?
It's really funny. I always think about that, and people always ask. And the one answer that I have still to today, after 7 years and 2 months running SEQSTER, is the fact that, I was a diehard Napster user for music. And I love the fact that I was able to sit in my home with my laptop and bring together, all my music in one place. It really set the tone for iTunes and Apple. Apple would not have a multi-billion-dollar business on their Apple Music now, which was, obviously iTunes before that, if Napster hadn't been out. And I just did a podcast, actually, just a couple of weeks ago on the Napster of healthcare, and that's SEQSTER. And so the light bulb moment was when I actually bought SEQSTER for $9.99 on GoDaddy.com.
Amazing. And it is incredible, isn't it? When you look outside of healthcare at different models and what's emerging, and you see that same application, that same usability within healthcare, even though it's a lot more complex, we kind of know that. So, I'd love to hear a bit more about what SEQSTER is doing, and you tell a story. Before we get there, I know you and I have discussed this story, but I love the way you describe this. You've met Bill Gates before, haven't you?
Yeah, that was a defining moment. And I think the weight of meeting Bill Gates on its own, everyone always wants to know the story and how it happens. So both my grandmothers actually suffered and passed away due to Alzheimer's disease. And, having been in the genetics world for 15 years before starting SEQSTER, we started with the Alzheimer's disease cohorts first. We thought if we can bring together a longitudinal health record and specifically coming up with a caregiver view, so that you can manage mom or dad's or grandma or grandpa's data from far away, was going to be useful. So we started working with a bunch of Alzheimer's care centers, specifically just around, the corner here of our homes in San Diego. I literally walked with a short demo of SEQSTER, walking into these centers, telling them like what we can do and how we want to help the community. And they were so open to us, working with their population, number one, and more importantly, they're hungry for technology. And so we started getting experience with developing this caregiver, model within SEQSTER. Now, I don't know how this happened, other than someone told someone that actually told Bill Gates that there's this company in San Diego converging health data for Alzheimer's disease patients. And at the time, his dad, Bill Gates' dad, was suffering from Alzheimer's disease, and it wasn't really public. So on a Saturday morning, I get a phone call from the top guy that manages Bill Gates' projects and says, "Hi, I'm blah, blah, blah. And we hear that you have something on interoperability for Alzheimer's. We'd like to fly you out so you can sit face to face. Mr. Bill Gates would like to spend 20 minutes with you."
Wow.
And I thought it was like a spam phone call.
Yeah, like a joke or something.
It was just ridiculous. I remember it was like 7:30 in the morning or something really early on a Saturday morning. I was still actually in bed, but you know how we roll over and at 6 a.m. we're checking our emails and then we go back. And Saturday morning, I was trying to get a couple more, minutes of Z here so that I can be re-energized for the day. And then I get this call. And so I asked him to give me his info so I can send an email because I really didn't believe it. Next thing I know, he already had my email. And by the time I woke up and, got my day going at like 10 o'clock or something, I got an email with kind of the same request. And it was an urgent request to be at one of his homes within a certain time frame. And then we set up the call for Monday. We bonded a little bit, got to know each other. Monday, everything was set. In less than 2 weeks, we are sitting down with Bill Gates. And that was just a defining moment. Instead of 20 minutes, I spent 3.5 hours.
Incredible.
And then he gave me a book that was Business at the Speed of Thought. It was the first book that he actually published after founding Microsoft. And he signed it and he put "Good luck" to SEQSTER. And then from there, he connected us to Boston University. And that's how we got our first research portal built, because the folks that he was funding used our technology. And then we got just great thought partnership on building out SEQSTER. But the best advice still to this day that anyone has given me, Paul, has been Bill. And he told me, "Ardy, this is not a platform. This is an operating system. And we built Microsoft Health Vault. And what you showed me today is 100 times better and 10 times even more beautiful on the UI UX, on the user experience, on the patient experience than what we did with the hundreds of millions of dollars we poured into Microsoft Health Vault." You gotta go take this B2B and not think of direct to consumer, because I was thinking direct to consumer then.
Yeah, that is, and I've heard you tell this story before, but that is amazing. I mean, what a boost and what a kind of pinch yourself moment as you sat there with Bill Gates. Like, absolutely incredible. Absolutely incredible.
Yeah, I think the dividend, for that was after that, I'm pretty fearless. I'm pretty relentless just because of my background and what I've gone through, my personal life to my professional life and journeys. But after you meet, someone like Bill Gates, and at the time when I met him in 2018, he was the richest man in the world, according to Forbes or whatever. And when you meet with the richest man of the world and a guy that's really pioneered software in a way and built out Microsoft and has done so much also for health in Africa and just so many initiatives. He's spent billions of dollars of his own money. I know he's a controversial figure, but you have to put politics and controversies aside and understand in that time how many people really get this opportunity to show their software to the guy that really took software to the masses. And I didn't have, I have like negative fear after meeting Bill Gates.
Amazing.
So I've met a lot of incredible people, right? And a lot of entrepreneurs are really scared to, I think, come out of their shell or, just go and say hi to someone at a conference that's a bigger figure than you. Obviously, I'm not shy whatsoever. I was never shy before, but after Bill, I was like, okay, like all those insecurities have to go to negative, not even zero.
Yeah, no, that's great. And maybe we'll do a second version of this video once you've met with Elon Musk. We might come back to this. But what an awesome—
That's coming. Just wait.
Watch this space. So let's fast forward to where you are now. And I love the fact that you know the exact years, months, and probably even days from starting SEQSTER. Talk to me about what you're doing with SEQSTER. Give me the overview of how you're working.
Yeah. So, ever since that moment, it's a great transition. We fully focused on not just mapping out the nation's, particularly starting with the US, healthcare systems, providers, and getting that interoperability engine really defined. But we built a data refinery engine on the back end to clean the data. We standardized all the ICD-9 and ICD-10 and SNOMED and RX norm, codes. And that took, a big effort from our engineering team. We got backed by Takeda Pharmaceuticals right out of the gates after the Bill Gates' meetings. We started working on building the enterprise data backbone for pharma. We started working on building patient engagement, not only tools, but features and that operating system for pharma. We deployed our white label, solution finally. We integrated ePro for patient reported outcomes. We built kind of like a Google search for markers and data so that you can see the comorbidities of data if you're a researcher. We integrated various different tokenization technologies within SEQSTER's operating system because pharma was looking for tokenization of data, and we're Switzerland, so it doesn't matter what we want or not. And, we've signed now multi-year, multi-million-dollar partnerships with some of the world's largest pharma companies. Obviously, what's public and what I can share is Takeda, AbbVie, Boehringer Ingelheim, some CROs, United Biosource. We've built out and are building multiple different patient registries. It's all powered by SEQSTER. National Pancreas Foundation of the United States is building the largest patient registry for pancreatic disease and pancreatic cancers.
Yeah.
And SEQSTER's technology is powering all that.
Yeah.
And then, we did some great things with Patients Like Me, which is a United Healthcare Optum partner there. And we have our biggest initiatives yet to be announced.
Yeah.
We have an incredible pipeline, and SEQSTER is just, helping one patient and millions of patients and dozens of enterprises at the same time because it's built for scale now.
Yeah, that's amazing. And I mean, just to step back to, you talked about data standardization. Very easy to say. In healthcare, phenomenally complex. I mean, you're feeding in data from all kinds of different sources, but the difference between data and usable data that you've standardized is just massive, isn't it?
It's massive. And, I think what people don't really appreciate, Paul, and I think a lot of your audience will, that understand data science, that understands connectivity, that understand connected health. It's not just about the medical records. It's
right.
The wearable data. How does your Apple Watch data, talk to your Garmin data that you used to have?
Yeah.
How does it talk to your Medtronic medical device data or your Dexcom blood glucose monitoring data? There's, 100 million different types of wearables that are going to come out in the next 10 years.
Yeah.
So the interoperability on just medical devices and remote patient monitoring is a whole segment on its own, and SEQSTER is ready for it.
Yeah. And this, again, I think is where people talk about real world evidence and real world data, but it's such a complex space. I don't think so many people really understand what it is, where it comes from, and how it can be used. And I think on that point, give me some examples where you can share. If you think about the companies you're working with, how are they using this data? How's it transforming what they're doing for patients?
Yeah, so I can start with, Takeda. Takeda's using it for their enterprise data backbone. We built all the FHIR, fast healthcare interoperability resources connections, and we engineered some great ways to ingest data, clean data. But it really powers, rare disease trials.
Right.
For example, there's a big initiative for rare disease that SEQSTER's technology was picked for. It was called the Global Commission for Rare Disease. And that was actually with Microsoft and Takeda and a bunch of other different types of tech companies that got involved. And SEQSTER's operating system was the technology for that. For AbbVie, we're powering, publicly what they've shared. And there's a press release on this. They're a research collaborative. And we built the digital front door for life sciences and for both observational and clinical studies. For United Biosource, we are powering their medical release program, where they're working with various different pharma partners, and our technology has been embedded in UBC's platform. And then for Boehringer Ingelheim, we're powering their real world evidence studies with real world data. And I think you said something that, most people might know, but don't understand it at the level that we understand it now, just because we spent 100,000 hours digging into real world data. And when you do that, you kind of become an expert, right?
Yeah.
And it's not 10,000 hours. You need 100,000 hours, I think.
Yeah.
There's never enough hours. You got to be a student of business, I say, always learning. Real world data is the data that exists on Paul, on Ardy, on Jennifer, on Stacy, on whoever. And that data has been siloed, whether that's at the NHS, whether that's on your wearable, whether that's on your genome, whether that's on your 23andMe test, whether that's on your, claims data. It's all been siloed. So how do you bring it all together to give a 360-degree patient view for both the patient and the researcher? How do you connect the dots? And the most difficult part is to have an operating system that can do that, connect it with patient registries and foundations, allow researchers to look at that de-identified data to advance drug discovery and drug development, and so many other things beyond.
Yeah,
that's what we're doing.
That's fantastic. And I know the examples you've shared there, these are just some of the things that you can talk about. I know there's a lot more that you probably can't. And as I say, those are just some select examples. But it feels like the potential for this is we're only just getting started. And where do you think this could take us? What's your vision for how this data transformation could really change what we're doing in healthcare? And what do you think needs to happen beyond what you're doing with SEQSTER to really enable that?
Yeah, really good question. And I think about that a lot. What I spend most of my time on, other than going at conferences to learn and connect with great folks like yourself, like we both just got back a month ago from JP Morgan Healthcare Conference, obviously, running around trying to, learn where the pain points are, where we can be ahead of the pain points. And so, we've had a good knack and vision from 2016 on this, and we just keep innovating. I push our teams to innovate on a daily basis. Innovation, I always say, is meaningless without execution. We have an incredible, elite force one team that I say that can take down any country. We don't need an army. We don't need to hire, 500,000 engineers to do what we've been doing. We've already proven that since 2016. A lot of companies think that you have to just keep raising money to solve problems. I actually think of it differently. I think you need to find what the problem is, see if you can solve it on your own, and then, you can sprinkle certain funding in it, whether that's from the strategics or from the customers, to build out better solutions for customers. And what's great about SEQSTER is our customers really are patients.
Yeah.
We do everything for patients. And so, that user experience, we spend a lot of time on. And that takes a lot of trial and error with real people. And so, our first cohort was 3,000 women in 2016 that told us how to build and put what button where, right? Most companies get their engineers to do that. We didn't do that. We had patients like yourselves tell us how they want to see their oncology data, how parents want to see their kids' rare disease data, and so forth.
Yeah. And I think that passion and that belief in the mission, whenever you and I have caught up, that always comes across, because you're right. You've got to raise the funds, you've got to make money, you've got to be a commercially viable company. But I know when we were chatting in San Francisco, you were saying the turnover rate from your team is phenomenally low because you've got that belief and you've got that mission about making a difference, which I just think is so powerful, so powerful.
And I think that's so important to knock on too, because we've had one person, and that was all due to health reasons, since 2016, leave on the engineering side. And if you look at the companies like Amazon and Facebook and Google, they're amazing, right? We all use them in our daily lives, but those engineers are switching jobs every year and a half or 2 years. And so imagine if they didn't do that. Imagine where your experience on your Amazon and your Google and Netflix would be. And so I think this is where healthcare has an advantage over tech. And I've discovered that by accident.
Yeah, that's great. And you also talked before about the impact you can have for patients. And we've spoken about what you're doing and how you're working with partners and the potential of this. But I'm guessing there must be some real hairs standing up on the back of your neck moments when you hear for specific individual patients the impact this has made. Can you share some of those stories?
Yeah, I mean, it's amazing. And, we have another Bill Gates of the industry, the first patient, the first innovator, the first physician, the first human being that thought that SEQSTER was something, but was skeptic and then tried it, was Dr. Eric Topol. And everybody knows Dr. Eric Topol. And he tried it in July of 2018. And it's on our Twitter homepage still as the pinned tweet, because I don't think we can ever have a better user experience. He had 4 different health systems, 4 different labs, his 23andMe data, his fitness data from his Fitbit at the time, his nutrition data from MyFitnessPal, and data from 1985 to present of 2018. And then he tweeted out and shared it publicly on August 21st, if I remember correctly, in 2018. And we had 4.7 million hits on our website. It destroyed our business, actually. Our website went down for a month and a half because we're like, how are we going to do this on the consumer side? Because we were direct to consumer.
Yeah.
And, that experience led to so many other patients contacting us. And we always give free access to patients that want to use this. We've been covered by CBS News and ABC News and just lots of different stories that, if we were on a video and we had enough time, I can play real patients, real caregivers that, utilized our technology and heard about it through the Nick Pink Socks network, actually, from Nick Adkins.
Good old Nick Adkins.
So,
what a connection.
Because he's got 300,000 folks that are part of his, tribe. And obviously people get affected by cancer, people get affected by COVID, people get affected by, certain autoimmune diseases. And when they want to put their data together, they reach out to Nick, and Nick says, you got to try SEQSTER. That's all I got to say, because we help, save one of Nick's really good friends' life.
And for anybody watching this who's not familiar with Nick Adkins and the Pink Socks movement, go to pinksocks.life. It is incredible. It's such a connector, particularly within healthcare, but beyond, and such a powerful and beautiful mission. Amazing network.
Yeah, and I think Nick's Pink Socks is such a great thing with SEQSTER too, because it's all about doing good,
Exactly.
right? And I think when you take that approach, whether you're a tech company, a startup, a founder, amazing things happen when you try to actually really help people. Helping people is beyond passion and purpose.
Yeah, totally agree. And people will look at what you're doing with SEQSTER, and I know, as well as the work you're doing transforming healthcare, other sort of entrepreneurs are inspired by this. There's a lot of activity in that space, but it's hard, as you know. And I was going to ask you a question, which is probably an impossible one, which is kind of the biggest challenge or the best piece of advice. I'm sure you've taken plenty of knocks and kept moving forwards. There's probably hundreds, but if you could isolate it down to one particular bit of advice you'd give to entrepreneurs based on your experience, what would it be?
Yeah, it is a very difficult journey. And to all the founders and entrepreneurs that are doing it, one, my hat's off to you, because I know how hard it is. But two, I commend you to keep doing it, right? It's all about not giving up. The best advice I can actually give any entrepreneur from my personal journey, and every entrepreneur is going to have a different answer for this, is you have to be obsessed with your craft. You have to be so obsessed with your craft that your family and friends think that you're crazy. That's the best advice that I can give you.
Yeah, absolutely. And your passion for what you do clearly comes across. How do you keep this energy level up? Because as you say, you've been on this journey for 7 years or so. Every time I've met you, you're just this bundle of energy, and it's great. It really comes across. How do you keep it up there?
Well, I think it's a combination of things, just personally, I have such an amazing personal journey story, as an immigrant coming to the US when I was 6.5. So many things happened when I was young in my life that affected me as a, adult. And having been around and seen it kind of all so fast at such a young age, just feeds into the, crazy Ardy energy, I guess you could say. But it does take a lot of energy. I do have down days. I am human, right? And when I shut down, I shut down. But when I keep going, I can keep going for a long time. I have an unbelievable support system. I got a wonderful, wife and family that believes in what we're doing. I have an incredible team that is, I would say, even more relentless, silently, obviously, than me.
Yeah.
And it's because we get to see, Paul, the results in real time with all the great work we're doing with the McKinseys of the world, Deloitte's of the world, Accentures of the world, pharmas of the world, CROs, and meeting these amazing figures like Bill Gates and Eric Topol. And, I sent an email to Jeff Bezos. He emailed me back in 36 hours. And, next thing you know, we were visiting Amazon, right? And so that's a whole nother discussion. But, that kind of stuff just keeps me going, right? It's like I have way more energy than I did before. And I will share this with you guys, something that I've never shared on the 52 podcasts I've done before this. We've almost gone under 6 times. I always say SEQSTER has 7 lives, right? And this year, in its 7th year, hopefully it's its 7th life. But it's not always, what everyone seems. You're always so close to another win, and you never know if it's going to happen. And you have to have that support system to keep going. Yeah. It's a combination.
Yeah. And thank you so much for sharing that, because I think people tend to have this image of entrepreneurs like yourself as being invulnerable superheroes. And as you say, you're people. And I think every company has gone through those moments where you go, we're going to be around in a month's time. So that's where having that support network, the old adage of put your own oxygen mask on before you help other people, is absolutely critical. So no, thank you so much for sharing. So just before we sort of close things down, you've touched on some of this, but anything you can share about what to expect in the next 12 months or so from SEQSTER?
Yeah, so let's give a teaser without, breaking any
Oh,
NDAs
fantastic.
of any sort, because I'm sure some customers and prospects are, listening to this. Look, we've been leading real world data within clinical trials, decentralized trials, clinical studies for a very long time now. And it happened to be that because we were backed by pharma at the beginning, which is really hard for, certain entrepreneurs to really get. I don't even know if there's a handful that have been able to, get backing from pharma from the beginning. And then getting pharma as customers from the beginning. You really have to have a solution and work collaboratively with the amazing innovators at pharma there. But SEQSTER was not built just for pharma. SEQSTER's beauty is that it fits in to, I say, the 3 Ps: pharma, providers, and payers. And so you will see this year, hopefully, some new partnerships that's gonna bleed into, other segments that hit even on more scale to help more patients. And we are really thrilled and excited about that, because it's taken a long time for those sort of entities to understand the power of our technology. But at the same time, those companies are also interested in doing things within clinical trials and doing things within, the pharma sector, I guess you can say, life sciences sector.
Yeah.
And so you're going to see SEQSTER being that bridge that brings together other segments with pharma and clinical trials. And I am just, re-energized, as you can see in my face and in my voice on this.
That's great. That's a great teaser. So we'll keep an eye on this, watch this space. And when this news does unfold, remember we were talking about it here first, even though you couldn't give too much away.
Absolutely. Pharma Forum is our place.
Look, Ardy, it was great to catch up with you in San Francisco. It's always great to catch up. But thank you so much for taking the time to share this story with the Pharma Forum viewers. I think what you're doing is amazing. I would say, best of luck. You don't need my luck. I think you're making your own luck. But I think what you're doing is incredible. Keep doing it and keep inspiring. Thank you so much for speaking with me.
Thank you so much, Paul, to you and the audience and everyone at Pharma Forum for, getting our great news out always, and really appreciate, your time always. We couldn't do what we do without you guys. So thank you.